Welcome everyone, and we'll get started. Perfect, thank you. Well, welcome all to the kickoff for the 2022-2023 cohort of the Rural Healthcare Provider Transition Project. This was created and funded by the Health Resources Services Administration Federal Office of Rural Health Policy. I'm Sally Buck. I'm CEO at the National Rural Health Resource Center. The center was awarded a 5-year cooperative agreement in 2020 to assist rural healthcare organizations in strengthening the foundations for value-based care through technical assistance, especially in quality and finance. And this is, again, a 5-year program, and we're happy to start year 3. Just a bit about the center. We are a nonprofit organization, and we are dedicated to sustaining and improving healthcare in rural communities across the country. The nation's leading technical assistance knowledge center in rural health. We focus on these 5 core areas in the transition to value, population health. We work not only with hospitals directly, such as in this project, but also with state offices of rural health in their rural hospital flexibility grant programs in the Small Rural Hospital Improvement Program. And we have worked for nearly 30 years in communities and with states in the Federal Office of Rural Health Policy for 20 years through these various programs, providing technical assistance directly to providers and communities as well as states. We have worked in collaboration partnership areas directly with network development grantees and in performance improvement in supporting, again, hospitals and clinics in strategic planning, financial, operational, and quality assessments, as well as evaluation of grant programs. And health information technology, we track the adoption of electronic health records and achieving meaningful use. That was about 12 years ago with the HIT extension centers. And then finally, workforce, which continues to be a challenge in rural areas and has range and from the center's perspective, working on provider recruitment and retention, leadership training, and employee engagement. The next slide is our diversity, equity, inclusion, anti-racism statement, and this was developed by staff in our DEI work group in 2021. Really reflects our guiding principles. And key here is that as we work to understand the impact of and seek to defeat racism and discrimination in ourselves, our workplace, and the world, this really guides how we cultivate our leaders at the center and in our organizations that we support, and how we build our programs and resources and deliver our technical assistance. And we have more about our DEI position and video at that link below. Want to view later. So in today's call, we'll be doing introductions of the team that you'll be working with at the center, as well as with our partners in the technical assistance and our Federal Office of Rural Health Policy project officer. And also we'll give an opportunity for all of you to introduce yourselves at your organizations, because that is definitely a part of our TA. We will have a review of the purpose and goals of the project, the technical assistance overview to give you a sense of the timeline for the different scopes of work, provide an overview of the peer-to-peer learning collaborative and ongoing webinars, as well as communication pieces we'll share with you, and definitely give an answer, question and answer time as well. So next, I'd like to introduce Janine Myers from the Federal Office of Rural Health Policy. Janine.
Thanks, Sally. Good afternoon, everyone. As Sally said, I'm Janine Myers, and I am the project officer for the RHPT program. I'm not going to take a lot of your time this afternoon. I just wanted to thank you so much, first of all, for making time to join us today on this very important call, and also to congratulate you on being selected to participate in this cohort of RHPT. You know, in the Office of Federal Rural Health Policy, we are really very excited about this program. We believe that this TA is just really great in terms of being able to prepare hospitals and clinics to build that foundation for participating in value. So I'm very excited to have you all on board. And again, thanks for joining us and congratulations. And Sally, I'll turn it back over to you.
Thank you, Janine. And we're just thrilled to begin the third year. Next up, we would like to have the rest of our team at the center introduce themselves, and they'll share how they'll be working with you in the project. And maybe, Angie, if we could go to gallery mode for a moment, or highlight speakers so we can see each other as introduced. We'll start with Terry.
Hello, everyone. I'm Terry Hill, and I'm the Senior Advisor for Rural Health Leadership and Policy. And I'm really glad to welcome all of you. One of the things I'm particularly excited about is my mother's entire family came from Fort Kent. So it's really nice to have, you know, that hospital participating. And so just really pleased to be here.
Thank you, Terry. Rhonda?
Hi, I'm Rhonda Barkas. I'm the manager for the RHPT project, and I got to meet a lot of you when Angie and I did our interviews. So it's good to see your faces again, and we're very excited. There was a lot of competition for these 6 spots. So again, congratulations to you all, and it's fun to get to finally kick this off together. So anyway, congratulations.
Thank you, Rhonda. Angie?
Thanks, Sally. Hi, everyone. My name is Angela Flam, and I am a project specialist with the RHPT project. And like Rhonda, I got to meet most of you during our interview calls. So nice to see you all again. I look forward to working with you over the next year. And congratulations on being selected.
Kiona?
Welcome, everybody. My name is Kiona Hermanson, and I'm the Senior Program Coordinator here at the Center for the RHPT team.
Thank you. And the other partner, we will have Stratus Health, and they will be working with you on the quality assessment, quality improvement portion of RHPT. And I think I will start with maybe Candy Hansen at Stratus.
Yeah. Hi, can you hear me okay?
Mm-hmm.
Okay, great. I will just go ahead and, if it's all right, Sally, I'll just go ahead and introduce our technical assistance team then. So, okay. So I am Candy Hansen. I'm a nurse by background. I've worked for years with clinics and hospital, both urban and rural, on quality improvement projects as they move from volume to value. This is my 3rd year on this project. I also bring health information technology experience to my work, and I'm certified in practice facilitation. And then we have Carrie, who for the past 5.5 years have primarily been working on the partnership to advance tribal health to support Indian Health Service hospitals across the country. She has years of experience working with critical access hospitals and small rural hospitals, clinics, long-term care facilities, and home care and hospice services to build and grow quality improvement, patient safety, and patient experience programs. And then we have Alana. Alana has over 20 years experience in healthcare as a registered nurse and has focused much of her career on improving health outcomes with evidence-based and best practice methods. She has her master's in nursing with a specialization in education and has led many projects, including trauma-informed care, organizational culture of safety, and quality improvement. And then we have Kathy. Kathy is a nurse who's worked in a variety of healthcare settings. Her quality improvement work has included rural palliative care, antibiotic stewardship, echo facilitation, patient and family councils, leadership, and operations impact. Marlene has a master's in public health and has just joined Stratus Health as one of the new program managers. Her background includes work in patient experience and direct patient care and emergency medicine. Her medical background, in addition to her work in community engagement and health equity, will bring value to this work as well. And then finally, we have Erin, and Erin has served in leadership and management roles in several rural hospitals, clinics, and correctional facilities across the state of Minnesota. She enjoys bringing a practical approach to quality improvement to implement best practice standards efficiently and safely in the facilities she's had the pleasure of working with. And that's our team, and we're really excited and looking forward to working with you.
Thank you, Candy. And now we'll turn to the Strawwater Technical Assistance Team. And the team is led by Eric Schell, who's chairman at Strawwater. Eric, I'll start with you for your team.
Hey, Sally, thank you. And nice.
Can you hear Eric?
Can you hear me okay?
Okay.
Okay.
We're sitting next to each other.
Yeah, we're anyway, my name's Eric Schell, and Stroudwater, we're involved more in bringing kind of an organizational strategy around the transition of payment. And then we've got anyway, the team here at Stroudwater, myself, and Eric, I'm a principal here, 25 years experience, CPA, MBA, and have worked all over rural America. Then I'm sitting next to me is my colleague, Lindsay. You want to?
Good afternoon. I'm Lindsay Corcoran, senior consultant at Stroudwater, and my background is in physician practice management, but have worked in the last 9 years in consulting, doing a lot of financial and operational, as well as clinical and quality improvement. So I'm happy to be supporting this project. We also are joined by our another colleague from Stroudwater. And Wade, do you want to introduce yourself?
Yeah, it's great to meet everybody. Great to see everybody. I will be supporting things on the Stroudwater side. My background is finance, CPA, reimbursement, so I'll be assisting primarily with financial and operational improvement. And that I'm looking forward to working with you all on this project.
Great. Thank you and welcome, Strawwater. Yeah, great to have our two partners for technical assistance. And now we're thrilled to recognize our 6 selected organizations for our cohort this year. And this came through the application process and interviews that we have 6 sites selected. And those range from Atrium Health Floyd Polk Medical Center in Cedartown, Georgia, which is a critical access hospital, Meeker Memorial Hospital and Clinics in Litchfield, Minnesota, again, a critical access hospital, Mercy Health, Markham and Wallace Hospital in Irvine, Kentucky, another CAH, Northern Maine Medical Center, Fort Kent, Maine, Critical Access Hospital, and Spear Memorial Hospital, Plymouth, New Hampshire, another CAH, and Swift County Benson Health Services, and that is a CAH, and some of these also have a rural health clinic as well. So we'll go to the next slide, just gives you a map of all the states. So in this cohort, we're on the central to or Midwest and north, east, southeast part of the country. Our last cohort, we're venturing more west. So it's great to have some new states participating in the program this year. And now we'd like and thank you, Jeff, for clarification that Northern Maine Medical Center is a PPS hospital. Thank you. We'll correct that in the listings. So we'd like to have introductions, and I'll call on each hospital in alphabetical order, and we ask you to introduce yourself and your position and the length of time you've been in that position or at that facility. And if you have others with you, I'll leave it up to you if you want to pass the mic around or hand off in Zoom to your colleague. That's great. So we can put faces with names. And again, that we know through the project over this year, you'll be working peer-to-peer in the learning collaboratives, as well as with the technical assistance providers. So I'll start with Atrium Health Floyd Polk Medical Center.
Good afternoon. This is Tiffany Connard. I am the Vice President of Rural Health for the Floyd Market. I've been with the Floyd organization for 29 years. We became part of the Atrium Health System in July of 2021. And if you keep up with the news, we are now also, we have combined with Advocate Aurora from the Midwest up near Chicago, Illinois area. And as of last Friday, we are now Advocate Health. So lots of changes here in our market, but today we represent Polk Medical Center, which is a critical access hospital, of course, in a rural health area. There are, I think, several of my colleagues on the line. Anita Jackson. So I'll just pass it to Anita, and Anita, if you want to pass it on to the rest of our team. But we are certainly glad to be a part of the cohort, and we look forward to the progress that we'll make and the colleagues that we will meet over the next during this journey. So thank you very much.
Okay, I'm Anita Jackson. I am the Director of Nursing here. I have been with Floyd 9 years. I have been in nurse management for the last 28 years. I'm very excited about this. I really do look forward to working and seeing what we can accomplish together. And I will pass it on to Joy. I believe I see you're on.
Hey, I'm Joy Hensley. I'm the clinical nurse manager of the emergency department here at Polk Medical Center. I've been a nurse for 20 years, and I've been with Atrium Floyd for 5 years, and I'm excited about rural health too. Thank you.
Great, thanks. Is that it, Tiffany, for Atrium?
I think Chrissy and Dawn are on also. If you guys want to introduce yourselves.
Hey, this is Dawn Truitt. I'm the Quality and Accreditation Coordinator and also the Health Program Leader here at Polk Medical Center. And I've actually been with the Floyd facility for 31 years. And I'm looking very forward to working with everyone.
Great. Thanks, Dawn.
Chrissy.
Hey, this is Christy McDaniels, and I'm the clinical manager of the inpatient department at Polk Medical, and I've been here for 15 years.
Okay. Thank you, Christy, and welcome Atrium Health Floyd Polk Medical Center, and we'll update the new name, Tiffany, when they that from you. Okay, now we'll turn to Meeker Memorial Hospital and Clinics in Minnesota. We have anyone from Meeker? Okay, well, we'll move on to Mercy Health, Markham and Wallace.
Hello, good afternoon. I'm Trina Stocker. I am the president at Markham and Wallace. I have been the president since 2019. Prior to that, I was the chief nursing officer. We are a CAW in Irving, Kentucky, which is Eastern Kentucky, but we're part of the Bon Secours Mercy Health System, which we are within a variety of states, mostly based in Ohio, but we do have hospitals in both of the Carolinas, Virginia, as well as in Florida, and we have 5 hospitals in Ireland. Within our system, there is only 5 of us that are critical access. Everybody else is PPS. So quite interesting. My team is on today. I have Nathan Nance, our program finance manager, Kathy Withers, my director of development. Dana Stepp is our program manager for grants. Ellen Stotts is my director of nursing, and I have one member of the team, Morgan Fowler. She is my director of operations. We do have 3 primary care clinics that are actually hospital-based rural health clinics. So she leads those, and that's our team.
Okay, great. Thank you, Trina. And I know we had the team from Meeker signed in led by Nicole. Are you able to?
Hello,
Hey,
can you hear us?
Yes.
Okay, wonderful. I was talking to myself last time. This is Nicole Signer. I'm the Chief Financial Officer here at Meeker Memorial Hospital. I've been with Meeker for a little over 3 years. Also in the room with me today, I have Michelle McGraw. She's our clinical analyst. I have Ann Lean, our Chief Quality Officer. I have Kurt Walbillig, our CEO, and I have Cindy Twardy, our VP of HR. And we're very excited for this opportunity.
Wonderful, and I'm glad you're all there together. That's great, and I know we captured the names there in the chat box too. So now we'll go down to northern, or should say up in the geographic map, Northern Maine Medical Center, Fort Kent.
Thank you. Good afternoon, and thanks for your opportunity. We're extremely excited. I'm Jeff Zawi, the president and CEO of Northern Maine. I've been here a little over 8 months, and I have quite a few team members. There's 3 on Zoom and a couple in the room with me. Elaine, you guys want to introduce yourself?
Sure. My name is Alan Bois. I'm the Chief Operating Officer, registered nurse by trade, and I've been with Northern Maine Medical Center for 28 years.
My name is Jennifer Albert. I'm the Director of Medical Practice, and I'm new to this role within the last 4 months, and I've been with Northern Maine Medical Center for 4 years.
And then we have, maybe I'll just introduce the rest. We have Sue DeVoe, who's our Director of Quality, and everybody's been in the organization a lot longer than I have. Sue's been in the organization for quite a few years. Carrie Therabal is our manager of physician practices. She's been in the organization for about 10 years. And Aaron Teachild is our Chief Financial Officer, who's been in the organization for about a year. So that's the Northern Maine team. And again, we're extremely excited to work with everybody and look forward to the opportunity. It's really good timing from our perspective.
Wonderful, great, and welcome the Maine Medical Center. Next, we have Spear Memorial Hospital in Plymouth, New Hampshire. And I'm just looking who's in for Spear.
If you're speaking, you might be still on mute.
Can you hear me?
Yep.
Hi, I'm Lisa Glotty. I'm the Director of Physician Practices at Spear Memorial Hospital. I just joined the organization back in July.
Welcome. And do you have anyone else from the team at Spear?
Michelle McEwen she's on, our CEO.
Great, welcome. Okay, and then Swift County Benson Health Services in Benson, Minnesota. That's Tyler. Are you able to unmute? Begin introductions, please. It looks like they have a couple people on. They said they signed on, but that maybe, I know in conference rooms sometimes as other group had to get double muted. So welcome. It looks like Tyler Lynch is on behalf of Melissa McGinty Thompson and Sarah McGarry Dehan. So welcome to our cohort. Again, we're thrilled to have you join RHPT this year, and I will turn it over to Rhonda for an overview of the program.
Okay, all right, thank you, Sally. And so, Sally already shared a little bit, just a reminder that the whole purpose for RHPT is to help move organizations in these different key elements of value-based care and preparing to become strong participants in a system that's really focused on value. As you heard, you'll be having two different pieces of technical assistance. One is the financial operational, and the other focuses specifically on quality improvement. Next slide. All right, so here are some bullet points of the technical assistance that you will be getting over the next year, or a little less than a year. Although some of the follow-up we'll do with you all will continue for another year. But you'll be getting focused on-site or virtual technical assistance from Stratus into quality improvement areas, and you can see here the areas that they will be working with you on, and Candy will talk about that a little bit more in a moment. You will be getting consultation and coaching to help implement best practices and as you're moving towards value-based care. Stroudwater will be working with you to look at your organization's financial readiness to participate in value-based care. We will be having a series of 5 peer-to-peer learning collaboratives where you will be able to support and learn from each other, and it's really focused on sustainability of your project. And then for anybody who's RHPT eligible, we have our health education and learning program, which is our webinar series. We'll talk a little bit about that later. And then finally, after the technical assistance ends at the end of August, then we do 1 year of follow-up with you to continue to support the implementation of the recommendations. Next slide. All right, and this is just a visual. One of the things we found this past year is that sometimes there was confusion over who does what. So created this visual just to help clarify that for you. So at the top, of course, is HRSA, who is supporting the project. The National Rural Health Resource Center, we are the ones that were awarded the cooperative agreement for the technical assistance. And so we do a lot of kind of the oversight, the scheduling, doing the post-project follow-up, kind of your just helping with all of the project management pieces. And then you can see that you have 2 different organizations that will do the technical assistance. And again, you've met everybody, but Stratus Health specifically will work with you all on quality improvement. Stroudwater works specifically around financial operational pieces. So you get really 2 very, very rich pieces of consultation with them. Next slide. And then this is just an overall timeline. We'll come back to this later, but just want you to see we worked very hard to try to make sure that things are as balanced as possible so that there's not, it's not too technical assistance heavy in any one month. So we start with the kickoff webinar December, and then Stroudwater actually is going to kick off their work with you first. You'll have introductory calls, and I think those have all been scheduled actually already. And then you'll also be doing the data request and submitting that to them. And then in January, that's when they'll be doing their virtual key stakeholder interviews with you. And I know Angie sent out an email that really identified what that specifically was going to be looking like. And then February, while they're working on your report, Stratus will begin working with you to do a meet and greet, start looking at what quality project you're going to work on, and then they'll start designing your project design. And then in March, Stroudwater comes back and they facilitate action planning with you, and their work is all virtual. And then they will follow up with you again in May and July, just as 2 touch points to see what kinds of questions you have and how they can support you in your implementation. And then that's where the work with Stratus Health really begins in earnest. They may be coming on site to some of your organizations, not necessarily everybody. But their work really continues. Usually it's bi-weekly till the end of the project year, which is in August 2023. So you can see their work really begins in earnest when Stroudwater completes theirs. And then moving concurrently through all of that from beginning in February are the 5 peer-to-peer learning collaboratives. All right, next slide, please. Okay, so I'm going to turn it over to Stroudwater to talk a little bit about their technical assistance. Then they will be turning it over to Stratus Health to talk about their technical assistance. Lindsay and Eric.
Yeah, thanks, Rhonda. So really Stroudwater's focus is understanding where hospitals and organizations are today, understanding where you are financially and operationally, and really identify some key strategies for improvement in those areas, with the notion of looking, with the end goal of looking and exploring ways in which that we can start to have the conversations and participate in alternative payment models or value-based payment arrangements. The assessment that we do through the data request and through our interviews with you all will include a kind of a population health readiness assessment. Again, it's really great baseline data for us to be able to understand kind of where you are on this kind of trajectory, which Eric will kind of walk through in just a moment. We're also going to walk through and talk a little bit about a health equity dashboard, and I'll speak to that in just a moment as well. Then the limited assessment around the financial and operational performance, kind of improvement opportunities relative to key industry benchmarks. We'll look at your provider care arrangement and complement, and look at payer contracts. Where are you participating in any kind of pay for performance initiatives, and then looking at really the market, and so inclusive of this assessment will be a high level market assessment for you all, and then conversations around system alignment and approach and what that strategy is. Next slide, please.
Yeah, so this is Eric. So several years ago, working with 4 rural hospitals in northern New Hampshire, we came up with this, what we call the transition framework, to help organizations through organizational strategy get from where we are today to where we want to be or where we see the industry going. And I'm just going to take 3 minutes and explain this, but going across the top axis, you'll see that if starting at the left is fee for service payment, and then we have it's phase 1, phase 2, phase 3, and then the last is provider-based plans. What this is, it's a timeline that's measured by where the payment system is and where it's evolving to. And the reason why the payment is so important is because essentially we organize ourselves around the functional imperative of the payment system that exists. And because of that, for example, in a fee-for-service payment system, the functional imperatives are to maximize sick care volume, maximize price that we get paid, and minimize expenses. And that form is, you could do that by yourself. So as we move to more population-based payment, or as payment evolves, the functions are going to change for providers, and thus having the payment as a driver of organizational strategy is absolutely critical. And so as we designed this framework several years ago, going down the y-axis, there are 3 strategic areas that have to be addressed and addressed simultaneous in line with where the payment system is. And so the delivery system, there's 3 initiatives that transform the delivery system. That's the 3 rows at the top. There's one, the blue bar in the middle is we have to create a healthcare system. We have a great sick care system. Our true healthcare system is underdeveloped because currently we don't get paid for that. And then the last is we have to pick up and move payment proactively, because if we create healthcare, if we transition sick care with the 3 initiatives at the top, and we maintain, kind of stuck in the world of fee for sick care, that we're going to kind of run ourselves up on the shore. And so what we've said is, one more thing to explain on this, is that there's an orange bar coming down from the top left. That's a strike point bar. So when the initiative, row 1, hits the orange bar, that has to be implemented. The first initiative in row 1 is we have to improve our operating efficiencies, quality, patient engagement. And we got to do that today because it hits the strike point, the orange bar. The payment system that we're in today, right now, phase 1 of payment is fee for service, but with tie-ins to quality and utilization control. That's the payment system that we're in now. The payment system of phase 2 is alternative payment systems built on a fee for service infrastructure. Think of that as ACOs and things like that. Phase 3 is when we start to it's a payment system, or alternative payment system built on an alternative payment model infrastructure. And start to think like Kaiser in that world. And then in the end, way out, probably 2034, we see this rolling up into large provider-led health plans and health systems. And so that's the payment system as it evolves. So row 1 in the transition framework, improve our operational efficiencies, quality, patient engagement. We have to do that immediately. We've lost 138 rural hospitals and haven't realized the payment system has moved. Align with primary care is the next. But today we should plan in column 1 to have a full alignment. And the reason why is primary care become revenue centers through attributed lives and patient attribution as the payment system evolves to phase 2. The next is system alignment, coming together with larger systems to take out big chunks of fixed costs. Note the strike point for this isn't out until phase 3 of payment, which is way out, 2030, 2032. So those 3 steps are how we transform our healthcare, our sick care model around creating healthcare. Think of it as crawl in column 1, walk in column 2, run in column 3, and sprint in column, in the last column. So today, patient-centered medical home, team-based care, data analytics capabilities, all of these are pieces of building infrastructure in the crawl phase of creating population health. And then go all the way down to the bottom where we are in terms of the payment. And right now, the payment systems that we receive incentives right now for example, submitting quality data to Blue Cross Blue Shield. There may be some incentives there. Getting paid for annual wellness visits, chronic care management, all of these things we get paid for healthcare in the current fee-for-service world. As we move up the transitional payment models, this is thinking of low-risk ACOs, where we can expand the amount of population in some type of a, quote, risk-based contract. And then the last is full risk cap plans, which is, that doesn't come together until we align with our larger systems. But in the end, we believe sick care, the first 3 rows, transform, the creation of healthcare in the middle, and the adoption of more and more risk into our insurance contracts and our Medicare contracts. The alignment of sick care, healthcare, and payment under one umbrella is provider-based health plans. And that's what we believe is the tip of the spear. So when we start the assessment, I'm sorry for going on, I went on for more than 3 minutes. Good thing Lindsay only took 1. Is that when we start talking with your organization around organizational strategy, we're going to essentially go down this row, these 7 rows, and get a feel for where we are in each of these areas as a basis for coming up with recommendations relative to best practices. So a lot of words there. You'll be getting more on this. We'll be going through this as part of the training seminars. So this isn't be the first time you hear about this. So thanks for allowing me to share.
Yeah, next slide, please. And this is just a quick snapshot of what we'll be providing to you all related to a health equity dashboard. And it's really hospital and service area specific. So, as we begin to have these conversations about understanding your community better, and, a key aspect is really growing your market share and supporting your community from a health perspective, we do need to take into consideration some of this data. And this is some of the data that we will provide and really talk about when we meet. And then lastly is the financial assessment of this. And this is really looking at where organizations are relative to the opportunity to participate in an ACO. So what would that mean, taking into some key assumptions, as well as building base years relative to your cost report and your financials. This is a component that we will walk through with each organization as well. Thanks. Oh, And our timeline, sorry, our timeline, as Rhonda had mentioned before, we're going to be starting with those intro calls. We will be sending out data requests. I think those do come from the center. But if there's any questions related to the data submission, those could come to me as a kind of a key point contact at Stroudwater. And then we'll be holding those key stakeholder interviews, as well as doing and targeting March for those report outs and action planning. And then the virtual check-ins.
So I think we're over to Candy now.
We are, and I'm going to leave my camera off because I've been having some audio issues today. So this is just a short intro of who Stratus is. So while Stroudwater was talking, so you're going to be going down two parallel paths, right? One of them is going to be financial with Stroudwater with a more financial focus. And with us, you're going to be focusing on outcomes and improving quality. And so based in Minnesota, we have a long history of working locally, regionally, and nationally to support health improvement efforts with rural health organizations and communities. And at our core, we're a quality improvement organization, and we're really looking forward to this opportunity. Some of the work that has intersected with this work is research, policy, and practice. Includes rural quality improvement technical assistance, or RHPTP, rural health value, PATH, which is partnership to advance tribal health. We also serve as the quality improvement network for Medicare and Medicaid beneficiaries. Excuse me. So in addition to the work that you'll be doing with Stroudwater, our purpose, as I just said, is to provide the training and technical assistance you'll need to identify, implement, and sustain a quality improvement project of your choice in one of the following areas. So quality improvement, patient safety, coordination of care, and patient experience and engagement. And we'll help you embed and improve a quality improvement program whose infrastructure will hopefully become your organizational culture when looking at sustainability and future improvement activities. You'll complete an organizational assessment that's aligned, which is different than Stroudwater's assessment, that's aligned with the focus area that you've selected that'll be used to help identify a technical assistance plan. You'll identify target opportunities for improvement. You'll develop SMART goals, which SMART stands for specific, measurable, attainable, relevant, and time-bound. We'll have regular discussions with you based on your facility schedule availability, but on regular intervals, where we'll support your progress, identify resources, problem solve, and celebrate. And depending on, I think Rhonda said this, or Sally said this, depending on your organization's need, there is a potential that we'll do a site visit as a part of our technical assistance plan. And we'll also work with you on action planning for future improvement efforts. So as was mentioned already, Kiona is going to be instrumental in getting our meetings set up. All right, so here are the descriptions of each of the potential tracks you'll be working on. We know that most of you have tentatively selected your track, but please know it's not too late to select another option. As you go through each of these descriptions, you might find something that you might want to explore to work on differently, and that's perfectly fine. Nothing is set in stone at this point. And then finally, here's just a rough timeline that we'll work with, and we'll work with schedules as appropriate. We certainly know that things happen in your settings, and we'll try to be as flexible as possible and just working with you on getting through your normal day-to-day operations. And I think that's all I have.
Thank you, Candy. Now I'll turn to Terry. Oh, Terry, you're still on mute. There you go.
Yeah, thank you. Thanks, Sally. I've had the privilege of working with both Stroudwater and Stratus for more than 20 years, and they're both extraordinary organizations. So, you know, they're going to be involved in what we call our peer-to-peer learning collaborative. And it consists of 5 interactive virtual sessions that provide education, a lot of discussion to share ideas, strategies, successes, challenges, and lessons learned. And one of the things we've learned at the center is that hospitals often learn best from each other. So this is going to give you an opportunity to interact, share some of the strategies, the lessons learned, et cetera. So we're really looking forward to some extraordinary conversations. We'll start with an introduction and update on Medicare's rural value-based payment models, you know, accountable care organizations, global budgets, et cetera, just as kind of an introduction. We'll then move into 2 sessions on that transition framework that Eric talked about earlier. So again, the transition itself is multifaceted. And this framework has been something that's provided a great deal of guidance for a whole lot of hospitals. Then we'll move into the quality topics in the sessions 4 and 5. And again, there'll be education that's provided and then an opportunity to interact and talk about what you've learned, your experiences, et cetera. So for those of us that work on this project, we always learn a lot from you folks, and it's kind of a special time to just basically to talk about what's going on and what we've learned and where we're going. So with that, I'll turn it back to you, Sally, or whoever goes next.
Thank you, Terry. And then we will hear from Angie about some of the learning and education webinars. Angie?
Great, thanks, Sally. So another form of technical assistance that you'll receive as part of the RHPT project are the Health Education and Learning Program, or we call them health webinars. And so the center will be hosting 8 60-minute webinars through the course of the year on a variety of value-based topics, such as the role of social drivers of health to advance health equity during turbulent economic times. We've got another one titled Value-Based Care is Here, Let's Learn About It. Health system support for rural value-based care. Making the ACO decision, how do you select an ACO? So that's just a little bit of a taste of some of the topics that we'll be presenting during these webinars. The first health webinar, the one on the social drivers of health, kicks off on Wednesday, December 21st, and you can register to attend that webinar on the RHPT website. The center TA team will also hold post-project follow-up calls with each organization in the form of what we call a recommendation adoption progress interview, or a RAP interview. And so the first call will take place 6 months post-project. So that would be around February of 2024. And the second one, 12 months post-project. So that would be August of 2024. And so these calls are 60 minutes, and they include your organization's CEO and then any other staff who participated in the RHPT project along the way. These conversations will take an appreciative inquiry approach for us to gain information about the success of your work. The primary focus of the interview is for us to learn about your progress, what's going well, where you might need additional assistance or resources, capture any outcomes or impact your work has had on your organization and or your community, and then to gather both qualitative and quantitative data for our various project measures.
Great, and Kiona will share with you some of the communication modes that will you'll be hearing from the center throughout the year.
Perfect. Thank you, Sally. I just put into the chat box the link to subscribe to our newsletter. Those who we have email addresses have been added to it. But if you would like to ensure that you are signed up, please use that feature in the chat box. In our newsletter, we currently send out upcoming events and registration links. We will also share spotlights from previous cohorts, hospitals and clinics, and the successes that they've had. We will share best practice examples, as well as any successful transition strategies that have been implemented. We also share a variety of value-based care tools and resources from our program, as well as other programs across the center. It's a great way to stay in the loop. I will share that the formatting of our newsletter will be changing in the upcoming months. And so it will be very simplified. And so when it is sent out, please feel free to click on the links that are provided to get further information, and it will bring you to our website where you can find a host of additional information moving forward. Next slide. The final step that we do have that we want to share in celebrating your participation in this cohort this year is the press release. And so in the follow-up email that you will receive from myself, there will be the playback, but we will also have each individual press release that has been customized to your healthcare organization. And we encourage you to review the press release for the information that it is correct to the best of your knowledge, but then share that with your local media, on your social media, whatever platforms that you feel is appropriate, to just share public awareness of your award. On the template that is provided, there is a space for your CEO to insert a quote or a little message if you would like. Please feel free to edit and revise it as you feel fit. And then just share that out there so that we can get the message out that you guys have been selected, as we are excited to celebrate with you in your participation of this upcoming cohort. Thank you.
Wonderful. Thank you, Kiona. And again, you don't have to write all those dates down, because you'll be bringing about them in the email, and you'll be on the listserv going forward. So Rhonda's got one more thing to share, and we'll open up for questions.
Yep. So that was a lot. I know that was a lot of information, but I hope that you're excited to see all of the different pieces of technical assistance that you're going to get. It's really a kind of a nice, well-rounded project, I think. So here's some of the dates. We've talked about them, but just again, as reminders. We've got several webinars already scheduled. And so when you get a copy of these, the PowerPoint, feel free to go in and start registering for those. This is just the next few months in a quick overview. Next slide, please, Angie. All right, so we're just going to open it up for any questions that you might have, anything that's not clear. Again, you'll be getting the playback for this, the PowerPoint, and other information. And of course, as questions come up, we always would want to hear from you. Please, if you're wondering something or you're not sure, please reach out to us. But I will pause there and see if anybody has any questions. You're happy for you just to unmute and ask your questions, or put them in the chat if you'd like to do that.
I will just put in one more pitch. If you have not already, please provide your email so that we can get you the further invites that need to go out to your team members, as well as further communications.
Yeah.
And you can put that into the chat box.
Yeah, and also just if you're not getting communications, please reach out to us, because I know your Stroudwater consultations have already been scheduled. Those should be on your calendar. Your Stroudwater meet and greet is on your calendar. So if for some reason you don't have any of this, let us know, because every now and then something maybe goes into somebody's spam box. Okay, well, with no questions, thank you again to the RIP team, Stratus, Stroudwater, Janine Myers, our wonderful project officer, and we are excited about this next year. Looking forward to getting to know all of you a bit more, and please reach out to us with any questions that you might have. Otherwise, I hope everybody has a good rest of their afternoon.